Hello, who is there watching already? Good evening to you. How are you doing? Please, if you're around, I'd like you to leave a comment and I can acknowledge your presence before I start. I'm going to start in like a minute. It's a very cold day here, so I'm kind of feeling cold as well. And I'm sure I'm sounding cold. Don't worry, when I start teaching or when I start saying what I have to say, I'm going to get a little bit warm. How you doing? Please leave a comment so I can see you. I see you just dropped a like. Thank you so much. I'm suspecting who that person is. Thank you for joining anyways. Thank you so much. Okay, we are going to be starting in a few minutes. So please be patient with me so my other ladies can join us as well if you're already here. Today we are going to be talking about sickle cell disease, or sometimes called sickle cell anemia. Yeah, it is one topic which I never really understood. Like, it was so complicated to understand. But after all the research and all the reading, I actually get to understand it, because it was made most times to think that it's just something that you cannot understand. Most times when people are talking about sickle cell, they're just like AASS, and then you're like, what's going on here? They make it so difficult to understand. But today we are going to talk about sickle cell anemia in a way that even a 10 years old can understand, or a 5 years old. So thank you so much, Lady Inda Sonita, for joining. If you're around, please leave a comment so that I can acknowledge your presence before I actually start. I'm starting in a few seconds. I'll be starting immediately, 3 minutes, 30 seconds. I don't want to waste so much time here. I'm just going to be explaining it as fast as I can. Thank you all so much for joining. So, few seconds to go. If you're around, please leave a message so I can acknowledge your presence before I start the session for today. I hope you learned a thing or two. So, today we are going to be talking about sickle cell anemia. We are going to be talking about the definition. We are going to be talking about the symptoms. We are going to be talking about the causes. We are going to be talking about diagnosis. We are going to be talking about complications. And we're going to be talking about treatment and prevention. That's all we're going to be talking about today. And I'm going to try to make it as simple as possible so we can all understand it. Thank you so much for joining, Lady Vera. Thank you so much for joining. Okay, I'm going to go on with the definition of sickle cell anemia. It is not anything too complicated. Sickle cell anemia is just some blood disorder caused by an unusual form of hemoglobin, which is called hemoglobin S. Normally, sickle cell is not really about your blood group. Like, you can be O positive, O negative, AB positive, AB negative, AB, whatever blood group you can have. But sickle cell anemia comes from your genotype, which is your hemoglobin. Actually, the hemoglobin is what transfers oxygen through your blood. And when there is no oxygen in your blood, you start having shortness of breath. Like, everything in the human body kind of works together. So oxygen actually passes through your blood, which is done by hemoglobin. And hemoglobin also is what produces the iron compound, which makes blood to have that red color. That is why if you've taken blood tonics before, you realize that blood tonics taste like rusted iron. That's one of the reasons why I really hated taking them when I was pregnant. But we have to, because hemoglobin contains that iron component, which makes blood red, and it is what helps to pass oxygen to all the other parts of the body which are needed. So hemoglobin is very vital. But when the kind of hemoglobin that you have has a small disorder because of the genes of your parents, then you can have sickle cell anemia. Sickle cell anemia is hereditary. It's like, for example, my mom has black hair, so I have black hair. My mom has very dark hair, so my hair is very dark as well. My mom has very thick hair as well, I have thick hair as well. Um, my mom has pink gums. I have pink gums as well. My mom has beautiful, nice nails. I do have nails as well. So that is just how it is gotten. The same way you inherit beautiful eyes from your parents or beautiful physical features from your parents is the same way which a child can have sickle cell anemia, which is why it is very, very important for you to know your genotype. The bad thing is with African hospitals, when you go to check these things, most times they won't even tell you to check it. And if you actually succeed to maybe take out your blood and you have to check these things, most times when you don't have any problem, they won't say anything. When you have a problem, the nurse might just look at you like that, or the technician might just look at that, and they won't say anything. Don't expect your doctor to explain it to you. And then in yourself, you start worrying and you're just confused of what's happening to you, of which it is not really that complicated, though it's a very complicated and life-threatening disorder, but it is something which we can prevent. That is why I'm talking about it today to mothers, because as mothers that we are, the best gift we can give to our children is a chance to a healthy life. So there are certain decisions which you will have to take so that your child has a healthy life, because your child has nothing to do with this. It depends totally on your decision. If you make the right decision for them, they have an entirely blissful life and beautiful, healthy life. If you make the wrong decisions for them, then their lives might not be as beautiful as it's supposed to be. So there is a lot in the hands of us parents for us to do. So I'm not going to be talking so much about their AC, AA thing, but I'm going to try to make you understand it very well. Now, I was talking about hemoglobins, still on the definition of sickle cell. Hemoglobins have different types. There is AA hemoglobin. Yeah, that's just how they call it. Don't think about it too much. Just know that there is AA hemoglobin. There is AS hemoglobin, which is someone who has AS hemoglobin is someone who has traits of sickle cell. But someone who has just traits of sickle cell in their blood might live as long as possible without any symptoms, right? So it's like you have traces of malaria. As Africans that we are, if you go to the hospital, you must have some small traces of malaria. But you can have those traces of malaria and then not have any symptoms. That is how somebody with AS hemoglobin has some traits of sickle cell because they have the S. Sickle cell is about the S. What mostly indicates is the S in your hemoglobin levels. And I will try to explain more how this affects a normal human being or someone who has sickle cell. So now, somebody who has AA hemoglobin, that's normal hemoglobin, that is good hemoglobin, which a normal person has. You don't have any traces of sickle cell anemia. You don't have any disorders in your hemoglobin in your blood. You don't have any disorders. Now, for somebody who has AS, they have little traces. Like maybe you might go and do your malaria test, as I said, and you have a little trace of malaria just because you're in Africa. Now, someone who has SS has sickle cell anemia. That is somebody whom can actually transmit it. Though somebody with AS can actually transmit it to their child, but somebody with SS is at very high risk. They have to be very careful who they marry. Even somebody with AS, you have to make sure that you marry somebody who has normal hemoglobin, which is AA. Most people have normal hemoglobin, but some people have the AS and the SS, which are dangerous hemoglobins. Now, they usually say if you have AS, which is sickle cell anemia traits, you shouldn't get married to someone who has AS as well, because your children will have, if you have, for example, SS, somebody who has sickle cell anemia normally, when we were in secondary school, I think we had a couple of girls and boys who had sickle cell anemia. If someone already has sickle cell anemia, it is better for that person to marry somebody who has AA, a very normal hemoglobin, such that it can it can fight it a little. Yes, there are children who have traces of sickle cell anemia, which is AS, but they will not show, in most cases, they don't show any symptoms and they live normal, healthy lives. Now, if somebody who has SS marries somebody who has AS, like somebody who already has sickle cell anemia, marries somebody who has just traces of sickle cell anemia, which is in a case where maybe a parent with sickle cell married somebody with a normal hemoglobin. When they come together, they will normally produce a child who has traces. So if you have SS and you marry somebody who has slight traces of sickle cell, there's 50% chances that your child might have AS or SS, which is traces of sickle cell anemia or the real disease, sickle cell anemia. Now, if you are somebody who has AS, you have traces, and then you marry somebody who also has traces, which is AS, you will have a 25% possibility of your child having sickle cell anemia. That is just how it is. In the hospital, the tests are really simple. When I go to diagnosis, I'll explain this more. But we just have to know that sickle cell anemia is just some disorder in your hemoglobin levels in your blood. Now, I'll give you some few facts about sickle cell anemia. So, it is usually said that patients with sickle cell anemia, like SS hemoglobin, who are from parents with either SS hemoglobin and SS, when they join together, that is a very bad combination. I'm sure you must have heard this before, but it's not about your blood group, it's about your genotype, and you need to test yourself for genotype. So patients with sickle cell anemia, like the ones which maybe you've seen around, could receive up to 10 units of blood each year. Like it's really a serious complication. And I'll tell you why. Another fact is patients sometimes develop an immune response to blood from donors. They receive these 10 units, but there are times which their bodies will not just accept the blood, and then it causes more complications. Now, another fact is there is no cure for most people with sickle cell anemia. But as technology keeps improving, scientists are working on some method to cure it. But there is treatment which helps relieve them of pain and helps them prevent further complications. Also, when I read this one, it gave me some joy, though it's not full good news. Patients with sickle cell anemia have a life expectancy of 42 to 47 years. Wow. Before, I normally thought it's 25 years. I'm sure you've also heard that. If you've heard something like sickle cell patients don't live after 25 years, please indicate in the comment section, because I don't think I should be the only one who heard something like that. But today, while doing research, I realized they can live up to 42 to 47 years of age, and that is so relieving. Now, people with sickle cell traits, this is a good one though. People with sickle cell traits have partial immunization to malaria. That is, people with sickle cell are kind of immune to malaria. They cannot have malaria as easily as we catch malaria. That is the only advantage of having sickle cell. At least he has an advantage. Everything does have an advantage and a disadvantage. Now, for the last one, sadly enough, sickle cell is more complicated in blacks than in whites. So now, I said before that sickle cell is some kind of abnormality or a disorder in your hemoglobin, the form of your hemoglobin, which leads to this sickle cell anemia. What is sickle cell anemia? Sickle cell is when your red blood cells, normally, if you looked at the post for this or the front page of this video when it started, you realize that you see some red round things and then you see some which looks like half moon. Yeah, so sickle cell makes your red blood cells, which are normally round and soft and flexible, they can easily move through your blood vessels very easily and fast. Sickle cell makes them to be kind of crescent shapes, like C-shaped, and then makes them hard in such a way that they cannot really move through your body easily. So that is why people with sickle cell anemia need blood transfusions, because when it makes it hard and then turns it to a crescent shape instead of the round and soft that it's supposed to be, it could go block some blood vessels. It's not as flexible as it is supposed to be. So it can go and block some blood vessels. And normal red blood cells, from research, it shows that they take 120 days, about 120 days, before they need to be renewed. So our body just keep producing it, but normal red blood cells take 120 days before they need to be replaced. Now, this crescent shaped or sickle shaped or C-shaped new blood cells, sickle cells that have been created, take about 10 to 20 days to be renewed, thus leaving the person with sickle cell with very few red blood cells. And when there are not enough red blood cells in the blood, oxygen cannot pass as it is supposed to, and it can lead to anemia, which is shortage of blood. So they need constant transfusion of blood for them to live long. I guess that is why their life expectancy is so low, because if somebody can take 10 units of blood in a year, like imagine how many blood they need to give. Oh my God. It's really, really a complicated thing, which is why mothers need to be aware. If the men out there are not aware, and us, the women, decide to tell the man, maybe if you see the relationship is getting very serious, you tell him, please, let's go and take a genotype test. So we know then that you're so much into it, and then it's at the point where you feel like, no, I can't leave this person, and then this kind of thing happens. But if it is for the children that you guys are going to give birth and you have plans of giving birth, it's worth breaking that relationship, because the main thing is to bring forth healthy children, not just bring children. So let's go on. Now, that is it about the definition of sickle cell anemia. Now I'm going to talk about some symptoms which people with sickle cell anemia have. Now, the first symptoms might appear around 5 months after birth. It appears in babies from about 5 months. And the symptoms will vary from person to person, since every person is different, and it might change over time. Some people might have the first symptom, which is anemia, shortage of blood. So it is said that sickle cell breaks down red blood cells very fast, and it would need replacement in about 10 to 20 days, while normal red blood cells will need replacement in 120 days, leaving the person with very low red blood cells, leading to fatigue and many other things which are not good for the person. So anemia is going to lead to low flow of oxygen in the blood and fatigue. Now, the next symptom which people with sickle cell anemia can come up with is episodes of pain. Like, they usually have a lot of episodes of pain, because when these normal round red blood cells, which are soft and flexible, which can go through your body very easily, don't go through the body very easily, they now can block some vessels around your chest, around your joints, and will cause what is usually called during sickle cell pain crisis. And this occurs when the crescent-shaped cells block tiny blood vessels in your chest, abdomen, and joints. It is very, very painful, and it can last from few hours to few weeks. And some very severe pain might lead to hospital stays. And some people with sickle cell have few of these pain crises, and some people have more than 12 in a year. So it's just really, really complicated. When children with sickle cell get to adolescent age and adulthood, they can have very chronic pain. They can have joint and bone damage, and also ulcers, and a lot more complications. So other symptoms may include swollen hands and feet, which is when the sickle cells block the flow of blood to the hands and the feet. Also, there is a possibility for frequent infections, since these Sickle cells, since they are crescent, they can block the flow of blood to the spine, which acts like a blood filter, thus leaving people with sickle cell prone to infections. And infections are one of the main causes of death for children with sickle cell anemia, which is the reason why doctors usually give vaccines to further strengthen the immune system of children with sickle cell anemia so that they can at least live longer. Now, the fifth symptom which people with sickle cell anemia usually present with are delayed growth or puberty. Normally, it is the blood which transmits nutrients and facilitate growth in the body. If your blood is not going through your body very well, it cannot carry nutrients to all the parts of your body. Thus, it's going to make your growth to be somehow retarded. So children with sickle cell anemia might have delayed growth or puberty due to the fact that their blood is not going all around their body, it's not circulating around their body, tissues and organs as it is supposed to. Also, sickle cell can lead to vision problems. Sickle cell can damage the retina, which is the portion of the eye which is responsible for processing visual images. Like when blood flow to that area is retarded or is blocked by these cells, it can lead to vision problems. Now, some of the main causes, as I said before, it is not about what you eat, it is not about what you drink, it is not like some of the diseases we have around which would say maybe malaria can be caused by mosquitoes. It's that easy. This one is some abnormalities in your genes which come from your parents, right? And when they come and mix in your body, they will now lead to this complication. Like I have explained before, both mother and father must pass this gene on to the child for the child to be affected. So the mother is either supposed to be AS and the father is AS, which is their genotype, or the father is SS and the mother is SS. If it is not in that case, then the child will have traits, but might not show any symptoms. So both the father and the mother must pass these genes to their children. Now, if a child has AS from parents who are maybe AA and AS, and then they get married to somebody who has normal hemoglobins, their own children might also have traces, which further makes it possible for other people to have sickle cell anemia. That's just how it passes from one person to another, just because of the genes and because of the people we decide to make our life partners. At least there is something we can do about it. It's not like some cases where there is not much you can do about it. But this one, there is something you can do about it. If you realize you are SS or you are AS, you can choose the kind of partner that you want. Though it's going to be hard. Everybody wants to be loved. Everybody wants to have somebody whom they can trust. And most times, that kind of bond is created with maybe marriage or an intimate relationship, right? But if you do have sickle cell anemia, you can find a bond with other people apart from getting married or other things, or find someone who you know is compatible with you instead of just going ahead and doing things anyhow and putting innocent children at risk. There is something we can do. Okay, now that's just the cause. That is just the simple cause of sickle cell anemia. Now, for risk factors, the main risk factor is when both parents have sickle cell genes, which is the the SS or the AS. Okay. So that's simply what it is. Now, for diagnosis, for you to be on the safe side, is like how tests are done for every disease. Like at times you might just decide to go do an HIV test because it can be passed through even your knives that you use at home or your blades or any sharp object. So you can do the test ahead of time, maybe if you're younger, to know your genotype. Most of us had to know our genotypes when we're getting married because for African parents and with the way our African medical system is, they don't educate people on most of these things. So if you're hearing this today, you can advise a young person to go check their genotype. I don't think it's so expensive. So it is a normal painless blood test, which for adults, it is usually taken from their arm. For kids, it is usually taken from their finger or their heel. The blood sample, right, is usually taken from their finger or their heel. Now, an unborn baby can also be tested for sickle cell disease by taking some of the fluid in the amniotic fluid of the mother to test the baby. So it can be done either ways. It can be tested for an unborn baby, it can be tested for an adult, it can be tested for a child. Now, when they are doing this test, they are looking for defective hemoglobin. So they can do the test for you and your hemoglobin is okay, right? They won't see any S hemoglobin in your blood. Now, if they do it for you and they see some traces of the sickle cell hemoglobin, then you have to start taking treatment. And what doctors usually do is they put patients on a particular dose of penicillin. I don't know if it's the tablet or whatever. I decided not to go so much into it because not you shouldn't go taking it because I said so. No, your doctor understands the situation more, and even when they do that test and they realize you have some abnormal hemoglobin, they'll do further tests to later confirm that you actually have sickle cell anemia. Now, some of the complications which might come up due to sickle cell anemia are stroke, because since the blood vessels, the cells, the red blood cells turn crescent and then they turn hard and they cannot move through your blood vessels as they're supposed to, the blood flow to the brain might be retarded and then it might lead to stroke. Also, another complication is acute chest syndrome, which is accompanied with fever, chest pain, and difficulty in breathing. This is when the sickle cell blocks blood flow to the lungs. So that is acute chest pain, which is also a complication that might come up from sickle cell anemia. Now, the third one is pulmonary hypertension. This is hypertension in the lungs, which leads to shortness of breath, fatigue, and is very common in affected adults. And this one is very, very fatal. So the thing with sickle cell anemia is it is always good to try to minimize complications because it's complications that can lead to death, right? If you have sickle cell traits and you don't have any complications, then you might live, you might live a normal, healthy life and you won't have any problems. You might live your life until maybe some random disease comes and takes you away from this earth, or maybe an accident or something. But if you now start having complications like stroke, like acute chest syndrome, like the pulmonary hypertension, then your chances of staying long get very, very reduced. So the best thing to do is to manage the chances of complications to come up. Another complication, which is complication number 4, is organ damage. So since sickle cell prevents blood flow to your organs, it can damage those organs because all those organs need constant blood flow, constant oxygen to function well the way they are supposed to function. So it might lead to organ damage like kidney damage, liver damage, spleen damage, and many other organs. Now, also, sickle cell anemia can cause open sores, like sores on your legs. Yeah, it causes it due to the fact that the blood vessels, the sickle cells block blood flow to the blood vessels. Now, another complication is gallstone. Gallstone is when there is a solid kind of composition which forms in your gallbladder. All this happens because red blood cells are not flowing perfectly to the organs the way they are supposed to in a case of sickle cell. Okay, so those are the complications. Another complication is blindness. As I said before, sickle cell might produce cases of vision problems. So these vision problems can get worse and worse and worse, and then the person with sickle cell gets blind totally. So that is it about the complications. We are almost done here. I'm so happy that I'm on time. Oh, there are two more. Okay, that's complication number 7. Now, another complication is priapism. Priapism. I hope I'm pronouncing it correctly, but it is spelled Priapism. It is a situation where men with sickle cell anemia have long lasting erections. This one is really bad. This one is so bad. Like, because the blood might not be flowing to their private parts, it might lead to long lasting erections, which is so disturbing to even think about it. So that is another complication. Another complication is pregnancy complications. Normally, if blood flow is not flowing very well to all the parts of your body, you're bound to have so many complications. And if you're even blessed enough to actually live a life until you get pregnant, then you might have complications like high blood pressure, blood clots, miscarriage, premature birth, low birth weight. Because all this is because your red blood cells are not normally the way they are supposed to be. They are now crescent shaped, which is like some C-shaped kind of size, and they are more rigid instead of being soft, so they don't move that easily around your body. Now, the only way you can prevent sickle cell anemia in your life, in your generation, for your kids and for their kids, is for you to take the sickle cell test before conceiving, and do the test. Make sure your children take the test as well, because you might never know. Maybe they might have been that gene in maybe some of your great grandparents, and then your child presents with it. You never know. So it is good for you to take the sickle cell test. Most hospitals do it, and most times when mothers are pregnant, they do it as a routine check for them, so that they know if they have to follow you up or you're going to have a normal, simple pregnancy. Now, another thing is to speak with a genetic counselor who can advise you if you are already pregnant and you realize that you have this gene in your body and it's going to give a chance of your child having it. You can speak to a counselor, to a genetic counselor, so they can tell you more about it and how you can manage it. Now, on to treatments for sickle cell anemia. As I said before, there is no cure to it, but the treatments prevent complications and can help the patients to live longer. So treatments include medications. Like I said before, most patients are put on a penicillin treatment for all their life. It helps them somehow. Also, another treatment is blood transfusion. This is when it has gotten to a severe level where it causes this pain crisis, where patients have severe chest pain or joint pains and all the like. They will need to do the patient a blood transfusion. Now, in this blood transfusion, what are they trying to do? They are trying to get red blood cells from the donor. So they get the blood, they remove red blood cells from the blood, and then they try to put it in the person. Now, even with the blood transfusions, there might be complications, because a lot of transfusions make the person more immune to more severe complications, right? So the more they transfuse you the blood, the more you are in a position to have more severe complications. That is why people cannot stay so long. That is why they have a low life expectancy. That is why they can only live to maybe 42 to 47, because at that particular point, maybe they have taken so much blood transfusion that it is leading now to more severe complications, that when these complications come, the patient can just die. So even with blood transfusions, it's not totally, thank you so much. It is not totally safe, right? Blood, it is something that they can do instead of doing nothing. When the patient gets to this severe pain crisis, what doctors do is they transfuse so as to help them produce more red blood cells to be able to send oxygen throughout their body and just to keep them healthy. So another thing which is done as treatment for sickle cell anemia is stem cell transplant, which is also known as bone marrow transplant. Like when I was reading this one, I just got ghost pimples because we had watched a series. A series, my partner should look at this and laugh now. We had watched a series where some people were extracting bone marrow from some other people, and it was so scary. Like the series was so scary. And when I think that they have to extract bone marrow from somebody to put in somebody else, that is a very invasive surgery. It's usually done with surgery, and it's something that can keep the patient in the hospital for a long time. And most times the complication now with bone marrow transplant, as with the blood transfusion, is they can actually transfuse the bone marrow, and then for some reason it's not compatible with the sickle cell patient, and then their body rejects it and it causes extreme complications. So it is just a very complicated disease that if we can try as much as possible, it is so better for you to take your test, know your status, know the status of your partner. It is far more better, you have a happier life if maybe you have sickle cell anemia and you decide that, okay, I can't get married to somebody else because if we give birth to our children, there are chances of that child having sickle cell anemia. And the stress and the torture on that child and what you as a parent will watch that child go through is more painful than staying single, I tell you. Because you would continuously blame yourself for that child going through all that suffering. Apart from the fact that you blame yourself, you will continually have to spend money. If they say some people go through take up to 10 units of blood transfusions within a year, you are constantly going to be spending money. It's not cheap to manage these things. Taking the test, knowing your status, and deciding to choose the person who works best with you costs far less than having a child with sickle cell anemia. Apart from the cost on the financial cost, the emotional cost is just something else. The cost on the entire world is just something else because you're increasing the population of the world. When you're increasing the population of the world with a child who really cannot contribute to the world so much. Though I've really read some touching cases of people who have survived with sickle cell. They fought so hard and they made so much meaning from their lives. As they said, if your mind is willing to do certain things, you can do them no matter the challenges that come your way. So I've read some really success stories of people who had sickle cell anemia, but they strived and they became something with the little time which they had to live. I read a case which a woman actually stayed 89 years with sickle cell anemia due to her lifestyle changes and other things. So, to be on the safe side, take your test and save the lives of your children. I can see a question from Lady Dorcas. She's trying to say, what if a woman is having SS and then the man is having AA? Can they get married? Yes, they can get married. I talked about this earlier. For a woman who has SS or a man who has SS, and like either of them has AA and one person has SS, they can get married. like that is the best case scenario for sickle cell anemia, because the children will have traits um in their own hemoglobin, in their genotype. They'll have traces, but the traces will not lead to any severe complications or any symptoms even. Like the best case for people with sickle cell is to try to marry somebody with AA. That's the best case for them. So having sickle cell is not the end of the world for you, as you can marry somebody with AA and your children will have traits, but they won't have complications. They can still live healthy, happy lives. So if there are any more questions, please ask. Let me answer your questions before I leave here. For I am done with all I intended to talk about concerning sickle cell anemia for today. We are going to be trying to send some posts to give you more awareness on sickle cell anemia. What is that? Oh! To give you more awareness on sickle cell anemia. But for now, this is all I have for you. And if you have questions, please do drop the questions, and we are going to try to answer them or leave you an answer later on, or answer to your comment later on. Like, it's a really cold day. It's like I'm freezing where I am. Please, if you have questions, do well to drop them so we can answer them before I leave. I have just a few minutes to go. Thank you all so much who joined. I can see Lady Jackie is saying thank you very much. You're welcome. I can see Lady Jackie. She's saying thank you very much. I can see, let me see. Oh, my touch is doing a great work in giving me some good lighting. Let me put it this way. Wow. And that's my phone touch giving that beautiful lighting, even more than my ring light. So, thank you so much, Lady Inda Sonita, for joining. Lady Vera, thank you so much for joining. Also, Lady Betty Bright, thank you so much for joining. Thank you, Lady Tambe Dorcas, for joining. Thank you so much, Lady Jackie Enanga. Thank you so much, Lady Juan, for joining. Knowledge, they say, is power. And if you're here, I believe that you've learned something. Thank you so much, Lady Uju, for joining. Wow, thank you so much. I hope you learned something. If you could not catch everything, just try to play the video afterwards and learn a thing or two. Our advice for every mother, every lady out there, to do a genotype test, right? Do it for yourself, do it for your children. Excuse me, try to educate them on it so that they know and they don't do this thing which they say love is blind. Because the kind of love that is blind is the kind of love that can lead to some kind of complications like this one, making children to suffer, of which they are so innocent and they deserve a healthy, happy life as well. Thank you all so much for joining. It's going to be goodbye from me. And let's keep raising healthy, wealthy, and exemplary moms, because it is a healthy mom who can have a healthy home, right? So, to have a beautiful day. May God bless you all. And if you haven't shared up to now, please, please, please click on the share button and share this video, as it's going to help somebody who needs this information to get it. And it is so important. It might be the little thing that you do to save a life out there. Okay? So if you are not shared the video, please share the video, leave a like, leave a comment, just leave something which helps to push this video. The more likes we get on our videos, the more Facebook, YouTube, which we are broadcasting with, pushes the video to more people, right? Because they realize that, okay, if people are liking this video more and they are sharing this video more, then it is something that people need to know about it. So they help you push it out for more people to see. This is most times not really about us, but about the impact you are creating in the world, right? The little things you might share might be something that somebody's just there waiting to see. And the fact that a lot of people are on their phones these days, you sharing something this educative and informative that might change your life is just wonderful. It's an awesome act to do, coupled with the fact that it wouldn't cost you a dime. Thank you so much for sharing already, and do have a beautiful day. See you all next week or within the week if we have a video to post. But test early for sickle cell anemia because knowing your status might save a life. Thank you so much. Have a good night. And it's going to be bye bye from me. I hope you learned something today. Thank you all again so much. May God bless you all. Bye bye.